Hi, I'm Dr. Karen Becker, and Lorraine has nominated Dr. Colleen Smith for a Game Changer Award. And we have Dr. Colleen joining us today to tell us more about her evolution into integrative and holistic medicine and more about the great work that she's doing with small animals. So, congratulations on your Game Changer, and thank you so much for joining me.
Oh, you're so welcome. I'm so happy to be here. And I just so excited because you're just such a pioneer in getting this
Mm.
alternative treatments, alternative medicine out in the world. It's a wonderful book and all this kind of stuff. And I'm just so happy to be here to kind of share my story and also hopefully share some more information for people who feel like they're stuck with
Beautiful.
certain treatments.
Yeah, beautiful. We are colleagues in the trenches in the sense that I'm anxious to hear your story, but inevitably what we learned in veterinary school is fantastic, great for trauma, acute infectious diseases. However, the vast majority of dogs and cats aren't dying from contagious diseases. They're degenerating. And that's probably your clientele base, like mine, is just animals that have not had the support that they need to be able to recover. So back up and first tell our listeners and readers about why you wanted to become a vet. And then once you became a vet, what's the story or the evolution to you adding more tools to your tool belt?
Oh, so I mean, I always wanted to be a vet since I was a kid, but in undergrad, I actually was at a school where I was like in a animal science program, but I'm from the beach, and I was the only kid from the beach, and everybody else was from the farms. And my counselor was like, "I don't think you're going to make it, so you should just get out." And I was like, "Okay, I guess I should go to a different major." So I went and became a biology major. So after I graduated, I worked as a chemist for several years. And then I was like, that's it. I'm going back to school. I'm going to do it. So 10 years later, I went back to vet school, and it was conventional minded. I didn't know much else. But before I went to vet school, I was a veterinary technician. And there was one weekend I spent at a seminar, and there was a veterinarian there at the school because I was at a university talking about acupuncture. And I was like, I don't know about this. But after the end of the weekend, someone told me to go take one of the horses out because one of the horses was on a PowerPoint presentation, and they did needles, needled the entire horse. And this horse that was there had horrible ring bone, horrible arthritis, and was running around this pasture. And I'm like, oh, what did you do to this horse? And I was, listing off all the medications they could be doing. And they're like, they did acupuncture. And I'm like, no, 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 no. They're like, yes, they did. And I was like, this is amazing. And I just kind of had this light bulb, eureka moment situation. Yep. So when I went to school, I kind of did conventional. And the crazy thing is, after school, I did an internship with the doctor who did the lecture years before that, acupuncture. So I spent 2 years with her, really balancing immediately Eastern and Western medicine. And so I kind of got thrown in the fire right out of school. But loved it. I mean, I just was like, this is such a great, it's a huge tool in the toolbox. And I very immediately blended, but it was kind of tough because I was still trying to get my feet wet and kind of figuring out how to treat, and then also advise with alternatives, which I didn't really have much of a background with, but
sure.
You
just figured everything out at once, which is actually gave you probably a really good jump start. A lot of people end up coming into looking for adding tools to their tool belt after they've been in practice, burned out for 15 years. But I'm really thankful that you did both simultaneously, because you were able to, you from the get-go of your career, you had a very well-stocked tool belt, which is wonderful.
Yeah, I can kind of see where one started and the other one kind of blended in, and yes. It just, it worked really well together.
So do you still treat horses or just small animal?
Well, I do. I have a clinic of my own now, which I've had it for 12 years. And I don't have space for horses, but it's funny. I have a little alley. And so if someone really needs to come, they'll just trailer the horse up into the alley. I'll jump into the trailer and do some acupuncture on them and send them on their way. But I don't have a field. I don't have any stocks. Yeah. I don't have a space to put horses, but they just can stay in their little trailer and I can work on them, but mostly small animal.
But that's awesome. And you know how. I don't know how to work on large animals. So you have the knowledge, you just don't have the space. I don't have space or knowledge. So you can, it's wonderful that you can provide that service. That's awesome. So you opened, so tell us when and how you opened your animal hospital.
I've been practicing for about 19 years. And so I've mostly practiced conventionally, even though I had, well, when I first started for 2 years, it was a mix. And then conventionally, and I got very frustrated because I'm like, I can do acupuncture for you. And they're like, just do some non-steroidals. And I'm like, I can do, I'm not making more money. This is going to the practice. And I got frustrated after about 6 or 7 years. And I decided to start my own practice in 2012. And I just bought this old chemical warehouse and redesigned the whole thing. And now I have my practice in Chattanooga. So it's great. I love it.
And tell us, for people that are tech savvy, like you have website, if people wanted to learn more, get a hold of you, are you on social media, website? How would people go about finding you?
So we're Chattanooga Holistic Vet.com is our website. And we're Chattanooga Holistic Vet on Facebook too. So, and Instagram, I think it's chai.vet. So we kind of Chattanooga Holistic Vet, or Chattanooga Holistic Animal Institute is the long name, and we call ourselves CHI for short.
Smart.
Yeah. So people are like, tea? And I'm like, no, it's not tea. It's a vet practice.
That's good. That's really good.
But,
so what do you love most? You get up in the morning. What do you love most about the work that you're doing?
it's a challenge. I mean, I'm now kind of the only deal in town. So I do a lot of second opinion. You probably see this too, is I'm a second opinion person. So they've come in, they've had everything done. They have a diagnosis of cancer or liver failure or something going on. So, and they're like, we've already done all these tests. We've already done all this stuff. Nothing's working. And I'm like, okay, it's challenging. So every day is something new. It's definitely not easy button medicine at this point. And I love the challenge. I think I would be so bored. If I was a desk job person, I'm not sure I'd be around.
Yeah.
So I love the challenges, and so I see mostly geriatrics and older, but when I get a puppy, I'm super excited because I'm like, ooh, let's start you from the beginning with food, nutrition, and, doing a minimal vaccine protocol. And so I can just kind of start them from scratch. And that makes me really excited.
Yeah, for sure. I totally get that. We have to celebrate puppies when we get them, especially second generation puppies. It's even better because they've gone from 0.5 pet parents to 2.0 pet parents, and they've got it, they're in. And then it's just like that. It is like very cellularly invigorating to get puppies with empowered, educated guardians. It's like, that's reason to celebrate every day for sure. So you've been a veterinarian for long enough now. You've had this amazing evolution of a career, all of these great modalities, helping lots of, I don't want to say bottom of the barrel, but oftentimes that's when people think about diversifying, or they get desperate enough that they go looking for alternatives that could be helpful. If you could tell the world one thing, or if you'd want the world to know one thing about the work that you're doing, or thoughts that have about where you're at right now, what would it be?
Start preventatively. And I'm so happy that you have kind of put it out there with nutrition. And I think that is a huge hole in our profession and the human profession, is that we're not looking at nutrition as medicine. And it totally is. You only work as good as the chemicals you put in your body. And I'm like, if you want to minimize whatever genetic stuff, some breeds are genetic predisposed to things, whatever is going on with your animal, if you change the nutrition, make it whole food, species appropriate. I've heard you talk about that so much. That is putting you so far ahead of the game.
Yeah.
That's so preventative. And it also as much as there's disease process already going on, it can so improve it. Yeah. Sadly, I've even told some people, if you don't change this dog's diet, they're just going to be on medication forever. Mm-hmm. That's the one gate to help this animal heal. And I have so many patients that they heal, and owners are like, who do you go to? And I'm like, well, so, and they are like, hey, I see how much nutrition mattered. I think I need to change my diet. So it's kind of cool.
It is super cool. I call that health traveling up the leash, because sometimes we don't think about it, for ourselves. Most of my clients anyway, take way better care of their animals than they do of themselves. Mm-hmm. My new clients, once people see it, they're like, if I apply health and wellness lifestyle principles to my life, do you think the same thing will happen? And it takes a lot longer for people to get healthy, but it is inspiring to see. We've got little role models in our house on the other end of the leash that can help reaffirm and build us up and give us the hope we need, because we've seen it happen with their lives. Their lives can be transformed. So I get that. That's wonderful. So Lorraine said your client that nominated you, she had a dog that had microhepatica with liver enzymes off the chart. And she said that over the course of the year, that her dog with from birth congenital defect, the liver no such thing as liver transplants with dogs, but her liver enzymes are now normal because of the protocol that you have used. And that also has to be incredibly rewarding for you.
It really is. The owner, it's sad when they come in and they start talking about what's going on and they just start crying, and you're just like, oh, they're devastated. And it's also sad that, if the disease doesn't fit the book or any kind of cure doesn't fit the book, then we're done. Hands up, I'm out. So it was good. The big thing too is I had a long conversation about everything this dog is also on: flea, tick, heartworm, the diet, of course, any other chemicals, what's our vaccine protocol, anything this dog's being exposed to, even stuff in the household. Found out she uses those little plug-ins for air freshener. Take those out. So it's just all these things they don't even think of, and it's not really addressed in medicine anyway. But it took a while. And we did some, rechecks too for the liver over the course of a year. And the owner was just flabbergasted that how can they be going down? And I'm like, we're healing the liver. And it is one of the organs that can heal. So it was great. I mean, she's just beside herself. Yeah. And the dog's whole appetite and attitude changed. I mean, the dog, the liver was a little bit of an aggressive dog, a little bit of a kind of grumpy dog. And that all changed. Yeah. So with some little herbals too that I did. So the owner was just like, I have a new dog. So
yeah. And the diagnosis hasn't changed, but the dog's quality of life is better. Longevity is improved. The dog is happier. The dog is healthier. The liver is probably obviously detoxifying because ALT is normal. This is exactly why we do what we do, but how very rewarding for you to be able to take kind of a woman with a hopeless situation and not just give her hope, but give her a happy dog with normal liver enzymes. It's exactly probably why you get up in the morning and do what you do.
Yeah, it's great. It's great. Even went back to her previous vet and they were like, we probably ran someone else's blood work because this doesn't happen. And I was like, yeah. Okay.
Yes. Yeah, it doesn't exactly doesn't matter. We're just thankful that everything is fine now. Yes. Yeah. Yes. I have also had that happen. I've had well-qualified, board certified doctors retract their diagnosis rather than admit that anything beyond conventional medicine could have helped. And it doesn't matter to me. I just am thankful that the animal is better. So yeah. And with that, we just move along. It is wonderful to see our community of proactive wellness practitioners, not just gaining steam, but partnering with our conventional clients and helping them understand that a defensive attitude or a them against us or a separated, divided profession is least helpful when it comes to not only serving our clients, but serving our own hearts. And that when we can recognize that we all have things we can bring to the table, we have skills, we have practice sets, and we have protocols that other vets don't, rather than be angry or bash or attack or criticize veterinarians doing things different than we are doing. I am thankful that we are beginning to enter into an era where veterinarians are recognizing that we need to be inclusive of one another and that it's okay that we have practice diversity. And I'm very thankful that Lorraine was able to find you and that her dog is doing as well as she is. And I'm just very thankful she also took time to nominate you for your Game Changer Award.
Me too. That was very sweet. I was surprised.
Yeah, it's wonderful.
Surprised. It was great.
Yep. Well, thanks for spending time with me today.
Thank you too. It was so nice talking to you. So exciting.